This is the Get Global Young Professionals Talk Global Health podcast, envisioned and created by the Irish Global Health Network and their student outreach team. I am your host, Megan Davis, Communications and Events Intern at the Irish Global Health Network and second-year medical student at the Royal College of Surgeons in Ireland. In this series, join me and my student outreach team co-host Aidan Desjardins, a microbiology student at Trinity College, as we talk to inspiring young professionals leading the charge in their respective fields, often operating in sidelines to their career, following their passions above all. My name is Megan Davis, and I am joined here by my co-host Maisie Jones. Today we are excited to welcome Deirdre Mangaoang. Here is a segment from our conversation.
I really enjoy working with volunteers and just kind of making sure that they have the opportunities that are available to them, because sometimes when you're so new in an organisation, you don't know what you don't know. So having somebody that will point those out for you and just give you a little push if you need something, that's terrific.
Deirdre Mangaoang is the Program Director of Operations at the RCSI Institute of Global Surgery. Her background is in the education and medical humanitarian aid sectors, mainly with MSF, the Red Cross, and Educate Together. She has worked in Myanmar and South Sudan and carried out short assignments in Jordan, India, and across Africa. In 2020, she was awarded a professional certificate in corporate social responsibility from the Law Society of Ireland. Welcome to the podcast, Deirdre.
Oh, thanks, Megan. Thanks for having me on.
So we like to start these episodes by asking our guests how they became involved in global health, and in your case in particular, global surgery. Would you mind sharing your story about how you started working in the education and humanitarian sectors and how you then transitioned to global surgery?
Sure. I suppose I started work, my career, I studied history and politics in university. That was my undergraduate degree, and I followed on with a master's in development studies. And I had like a vague idea that I wanted to work in human rights, but no real concrete plan of how that would actually, what that would look like even. But I just got very lucky. My first job was with Educate Together. And Educate Together is an organisation that sets up schools that are equally open to children of all backgrounds. And my job was the team assistant there, like the office receptionist and the most junior position. But it actually gave me kind of like a front row seat to seeing like people in communities working together to translate something that's like an educational right into a reality, like a tangible reality of having an actual school in their community. And I went to lots of meetings around the countries and community meetings, and it was just so informative. And like, I think I just got really lucky. My bosses at Educate Together were more like mentors, Paul and Deirdre particularly, and they knew I was interested in human rights, and they allowed me to work on Educate Together's shadow report to the UN Third Committee. And this UN Third Committee, this is the committee that reviews countries' progress on the countries that have signed up to the Convention on the Elimination of Racial Discrimination. I think it's every 5 years countries have to report back in on what they've done, and other countries can ask questions and they give recommendations. But also civil societies and NGOs in that country can also submit a shadow report as well on what's happening on the ground. And like I said, I got a chance to work on the Educate Together shadow report that was submitted. And they let me go to Geneva, which looking back on it now, I think was really great of them. Like I really appreciate the opportunity. And then somebody on the committee asked a question about schools in Ireland, and I got to answer. And then a few weeks later, the recommendations came out. And it was a formal recommendation to the Irish government that Ireland needed to address admissions policies for schools in Ireland so that there could be no discrimination against children of any background. And this was something that Educate Together had been campaigning on for years. Finally, there was a UN recommendation. That was a huge deal for the organisation. Like, it was momentous. But for me personally, like, I just loved being at the UN, the whole international experience, the settings, the diversity, the people, the politics, the passion, all of it. And like, I knew then that I wanted to work in internationally focused organisations. And my next job was with the Red Cross, where I was looking after another admin role, but I was looking after people who were going overseas. We called them delegates, so Irish Red Cross delegates going on missions abroad. And as you probably know, like, the Red Cross works in a lot of disaster relief areas, in conflict settings. So a lot of the people I was working with were medics, were like nurses, doctors, other health professionals. And I really enjoyed getting to know them and just kind of building my understanding about what humanitarian work actually involved through seeing them go out on missions and come back and just hearing what they were doing. And then from the Red Cross, I went to work with Médecins Sans Frontières, and that's where I really got immersed in humanitarian aid. Médecins Sans Frontières, or Doctors Without Borders, or MSF, they work in some of the most like acute emergencies around the world. and the work is based on medical care and advocacy, or speaking out about the work that's happening. And I worked in both human resources and communications roles there, mainly in Dublin, but also missions in South Sudan and Myanmar, and then a number of shorter trips just lasting a few weeks to different places. It was a very full-on, intensive kind of role. Like, I joined MSF, I think, just after the Haiti earthquake, and was there when there was the outbreak of the war in Syria, the Japanese tsunami, the Ebola outbreak in West Africa, and like dozens of other emergencies that don't make the news at all. And like, I think MSF is, no organisation is perfect, and MSF certainly isn't, but in terms of expertise in medical humanitarian aid, like, MSF are the people I'd want to see on the ground. And with MSF, I worked a lot with surgeons, and surgery obviously being needed in emergency contexts. And I came to really respect the level of training that surgeons undergo, and also kind of got a bit of an insight into the challenges of providing surgical services in many parts of the world. And I suppose that understanding kind of led me to my current role now with RCSI, the Royal College of Surgeons in Ireland, and working with their Institute of Global Surgery.
That's brilliant. That's really interesting. And you mentioned then that you had mentors kind of early in your career. Do you think it's important to have mentors when pursuing a career in global health? What's your kind of thoughts on that?
I really think it is. And like, mentors are invaluable, and both kind of formally and informally. I suppose what the mentors I've had, they've steered me in the direction that I needed to go without me realizing I needed to go there. And I suppose in turn, I've tried to pay that back as well. Like, anybody coming in, like, I really enjoy working with volunteers and just kind of making sure that they have the opportunities that are available to them, because sometimes when you're so new in an organization, you don't know what you don't know. So having somebody that will point those out for you and just give you a little push if you need something, that's terrific. So really appreciate the mentors I've had.
So for those who don't know, what is global surgery and why is it important?
Well, I can give you the definition that we use here at the Institute. We say that global surgery, it's a field that aims to understand and address the impediment to the equitable provision of safe, affordable and timely surgical anaesthetic and obstetric care to people and patients worldwide through research, education and international collaboration. It's a long sentence, but basically we see global surgery as part of the parcel of public health, but it's a very neglected part of public health. And you asked me why it's important. Because like 5 billion people around the world don't have access to this safe, affordable, timely surgical care, but it's not kind of an equal level of care. It's like the lack of access is most severe in sub-Saharan Africa, and 93% of the population there is unable to access surgical care when they need it. So we're working in addressing that, understanding why that exists, and seeing what we can do to fix it, I suppose.
That's great. And as part of your work with RCSI, you were involved in the Irish aid-funded RCSI COS ECSA collaboration that aimed to work towards training and retraining more surgeons in sub-Saharan Africa and making better surgery more accessible. Could you tell us a bit about that?
Well, I was saying, like, one of the main reasons for the lack of access to safe, affordable and timely surgical care is the fact that there's a huge shortage of surgeons in sub-Saharan Africa. Now, there's many reasons why there's lack of access, but lack of surgeons is one key reason. And the collaboration program between RCSI and COSEXA, the College of Surgeons of East, Central and Southern Africa, it's like a long-term partnership to address the need for surgeons. And the best way I can explain it is, like, we've all heard the phrase, like, give a man a fish and you feed him for today, like, teach him how to fish, you feed him for life. But then there's a third part to that, and that's where I think, like, the collaboration program comes in. It's like, if you develop local fishing training colleges, then you've developed sustainable capacity in the country. And that's what we're trying to do through this long-term partnership. And it works. It's been going now for 13 years. Through that, over 550 surgeons have graduated, and over 90% of them are staying at home and working in their own home countries. And that's really important, because for a long time there was kind of a myth that there wasn't really any point in training people, giving people high skills, professional skills, because they're just likely to emigrate. But we've actually shown that if you can provide that training at home and they don't have to go abroad for the training, they're much more likely to stay at home. And then each COSEXA surgeon, goes on average to train 5 other surgeons. So it's a cascading effect. You're building the capacity there for the long term, for a sustainable future. And the program is still going really well. In 2019, we expanded the program to now start work with anesthesiologists, because we all know there's no safe surgery without anesthesia as well. And we already have, I think, 19 anesthesiologists graduated from the program And this year we just started working with operating theatre nurses as well. Everyone will tell you that surgery is a team sport, so you need to train all the skills involved in the operating room. Overall, it was a terrific program to be involved in. Like anything that's kind of sort of like for a long-term vision, there's a lot of committees, there's a lot of policies, there's a lot of meetings, and that can sometimes be, it's like they're just part of the process. But then like it's really rewarding too. Like a few years ago, I got to go to Zambia to meet two little girls, like Bupe and Mapalo, and these were conjoined twins. They were formerly conjoined twins, but they were the first conjoined twins that were successfully separated in Zambia by a Zambian team. And these were like surgeons that had been trained through the COSEXA program in Zambia, and just seeing the difference that made, like previously these twins would have been either flown out of the country to have the operation, or like a hotshot international surgeon would have been flown in to do that surgery. But now, because of like initiatives like the COSEXA program, the surgeons were able to do that surgery at home, and it's a huge capacity to have in a country. And the twins were like little mini celebrities, and yeah, it was just so lovely to meet them and their families, and then meet the surgeons and everybody who'd been involved in that procedure.
Sounds like a really incredible story. The global surgery movement highlights the urgent need to address the lack of adequate surgical workforces in countries in sub-Saharan Africa to achieve safe and affordable care for their population. So from your research and experience, what type of interventions and collaborative support are needed to address this situation?
That's a good question. I think like workforces need to be trained, and training takes time. That's the first thing, that there's really no quick wins at all. And I think healthcare workforces especially, it's not enough just to like, you get your diploma or your degree and then it's finished. That's not the case. You need to have continuous professional development and access to training, so your skills are always sharp. So you're always up to date with the latest skills that are most appropriate for the patient that you're treating. So I think kind of long-term interventions and partnerships between committed training programs are really key. So, and like say with the RCSI COSEXA collaboration program, you have RCSI and COSEXA, who are both the mandated training bodies for surgeries in their region, working together. Like both organizations are playing to their strength. It's a really good match, and both organizations are very committed. The relationship has been built up over a number of years, and like people move on and people change, but I think there's a level of trust there that really helps keep the intervention going really well.
From your past experiences, what is key to developing effective and inclusive partnerships?
I think actually kind of having a sense of humor, and I know that sounds a little bit silly, but like the work we do in global health and involved in it is serious work, and it's right to take it seriously, but I think don't take yourself seriously too much if you can at all, because a sense of humor will go a long way with people, and especially now, I suppose, in the last year when we're all working remotely, it can be harder to make those relationships and to kind of see humans behind the policies and behind the emails, and like when you've got a long email thread with like 27 CC'd people on it and you're trying to get a document over the finish line and a policy or a grant through, just being able to kind of realize that like there's people behind this, and kind of a little sense of humor about things when appropriate, that goes a long way.
Yeah, that's really good advice. And where do you see yourself in the next 5 to 10 years, do you think?
I really hope I'm still in the maybe global surgery, global health space. I recently completed a kind of a law certificate in corporate social responsibility, and that's an area that really interests me as well, like how organizations can contribute to, I suppose, like making the world a better place. And I don't know if that's a natural progression or not, but I don't think really anything in my career has been a natural progression to date. So why not do something different? But I think there's a lot of interest now in kind of a lot of realization how kind of the world is such a small place, that we're also responsible for each other, and what happens in one country can affect in another country, and people like within a matter of days and within a matter of weeks. I think there's going to be a lot of it's just something I'd like to work in this area, just try and continue working with great people as well.
That's great. And can you tell us about some individuals who have or continue to inspire you?
I suppose I think one of the lovely things about having some experience and working with different organizations, and in the global health sector, global surgery, you work with some really brilliant people who have so much energy and passion for what they do. Some of the most hardest working people I've ever met have been in this sector. people who just go the extra mile, whether it's for their patients or whether it's for a particular project that they want to get done. There's too many people to name individually, but I just really respect people who work really, really hard in difficult circumstances and don't worry about the small things, and don't have people who don't really have egos. And like I said, don't take themselves too seriously, because the work itself is serious enough.
Before we wrap up, what is one piece of advice that you would give to someone looking to pursue a career in the field of global health?
One thing I think I would say is, if you're lucky enough to kind of work with good people, sort of hold on to them. The global health sector, it's really quite small, even internationally. And you meet the same people all again in different roles and in different circumstances. But you always recognise the people that you get on well with, that you work well with, and they can be much more valuable than kind of chasing a particularly big salary or a very kind of high profile role or something like that. Just if you're lucky enough to work with a good team and people that respect you and that you respect, that's really something that should be prized. And I'm really lucky that I have managed to work with great people throughout the years, and my current team are just fab. And even the people that I work with remotely, I'm really happy to have them on board. So again, I think I've gotten very lucky. But if I can just say that I really appreciate the people I work with now.
Finally, are there any new and exciting projects that you're involved in at the minute?
We have a couple of things coming up next year that I can't at the moment, the two are a little bit early stage to speak about, but we're going to be launching the first Dublin meeting in patient-centred global surgery next March. With everything going on at the moment, we're not exactly sure of the format, but we think some part of it will be in person and some part of it will be fully online. But I'm really excited because it'll be one of the first global surgery conferences that puts the patient at the centre of the research and the focus. So I'm really excited to see what kind of abstracts we'll get from that, and we have some quite exciting speakers lined up to come to that as well. And that's keeping me on my toes at the moment.
It sounds very exciting. So thank you so much for joining us on the podcast today, Deirdre. It was a really wonderful conversation about global surgery. And if you would like to learn more about the Irish Global Health Network or the Student Outreach Team, visit www.globalhealth.ie, where you can sign up for our newsletters. Thanks again for tuning in.